everyone, thanks for joining. As a consulting firm that specializes in strategy and implementation across all commercial functions, we're really excited to discuss some of our learnings when it comes to developing successful patient support programs. Over the next 20 minutes, we'd like to cover 3 core focus areas that we feel would be valuable to share. The first is evolution. What trends are we seeing across companies large and small, especially as we take into account different disease states? Second is ideation. How do you approach building this next generation support? We keep hearing phrases like beyond the pill and meeting the patient where they are, but what does that actually mean? And how do we balance that with organizational priorities and timing constraints? Or those 2 dreaded C words, cost and compliance. The third is implementation. What does this actually look like in practice and not just conceptually? We'll hear from an industry leader we collaborated with on how they approach developing a support program that addresses one of the most unmanaged diseases of our time. Now, if everyone can think to the past 2 years, especially in the COVID timeframe, how many of you have participated or even led an innovation meeting? Or perhaps something along the lines of digital transformation? Now let's think about how many times you've been in that same meeting where the phrase, we need to be more like one of these companies was mentioned. Perhaps we need to be more like Microsoft. We've often been in meetings where individuals jump to incorporate what these companies are already doing. For example, Amazon does same-day delivery, so how do we get that for our product with our patients? Or perhaps Apple has a watch that can track blood pressure, so how can we have a wearable as well? But after spending a great deal of time really focusing on the patient experience, I have to admit we often miss the mark. Because while these companies are out being disruptive, we spend our time jumping straight into solution mode and don't actually consider our consumer, who ultimately is the patient. And that's not to say we can't leverage learnings. We absolutely can. For example, Amazon just announced that they were partnering with Teladoc. So we wouldn't be doing our jobs if we weren't considering how we could incorporate that as well when it comes to our patient base. But however, that is a solution and it is not actually fully defining the problem, which we need to be a lot better at. When it comes to evolving standards of support, there's a lot of things to consider. The industry has shifted quite greatly in the past several years when it comes to patient support. Patient support has holistically gone through massive changes, and with increasing healthcare costs, polypharmacy concerns, and a wealth of misinformation, it's becoming a lot more critical to address the supportive functions around the product. Non-compliance amounts to several hundreds of thousands of deaths a year, so what was once merely seen as supplemental is now essential. As you see on the left-hand side, support was fairly one-dimensional in nature. I like to call this short-term product-focused support, where you made sure the patient could start on your product. These components were often run by external vendors and all work in disparate silos where patients sometimes might get duplicative information or no information at all, and there was limited way to track that. Product and disease education was often lengthy articles or emails that would get lost in inboxes or never fully read. What we're seeing now is a massive shift to what I'd like to call the true patient journey focused support. We look at this as long-term disease state and disease journey support. We now think of leveraging partners instead of just vendors, and one where it connects all of the disparate services to ultimately reduce redundancies. Perhaps when we think of partners, we can think of someone who can directly interface and connect patient information to a healthcare provider, of course, compliantly. There'll be more on that later. It also expands the types of services the patient can have access to. And ultimately, it provides the ability to have personalized experience for patients where they receive content and communications when they are ready for it and throughout the channel that they truly prefer. As we've already mentioned, and will likely continue to, make sure you ground everything you do in true key patient insights. Ensure you do your market research appropriately, or potentially have access to a panel of patients who can provide quick feedback at any given time. For example, a project we worked on a few years ago actually brought in patients as part of the experience mapping workshop, so they could work in tandem with all cross-functional teams to truly identify pain points. That first step is always to map that full patient experience. What we're looking at here is the traditional 6 steps when it comes to the patient support and the patient experience. And this can always shift when it comes to the product and the disease state, but these will be the traditional 6 steps to go through. The first 3, as I've mentioned before, tended to be addressed by programs of the past, but even those are continuing to evolve as we look at them. For example, when it comes to product acquisition, historically, we would see that it was just financially focused, but now we're seeing the shift that it's going much beyond just finances. For example, when it comes to products that require in-office administration, how does geography play a role? Particularly in rare disease or oncology, where treatment centers are few and far between. The latter 3 are across outside the disease support. When it comes to tracking improvement and maintaining, tend to be the forgotten components that the industry is now actively solving for. For example, when it comes to signs of improvement, we're starting to see a lot of companies invest in tracking and monitoring, potentially looking at connected devices and remote patient monitoring. How can we continue to help patients truly maintain their overall state when it comes to managing their disease? Now, there are several gaps associated with each and every one of these phases. And what we're going to display here is merely a drop in the bucket of the vast concerns that may arise. It's critical to assess and prioritize for your brand and your patient base, but there are 2 key takeaways that I'll leave you with. One is that while this might be displayed as a linear flow, it no longer acts as one. A patient might go through any one of these phases at any time and at any cadence, and that's where personalization comes in, and oftentimes things like AI learning and modular content play a large role. 2 is that you can solve for every single one of these priority problems, but don't forget enrollment and taking into consideration how patients will actually get into the flow of your support program. Make sure to communicate your value proposition to all key stakeholders. For example, how does this program ultimately help the patient? Does it perhaps reduce any burden for their healthcare provider? Make sure that you're actively communicating that value proposition and you ensure that you will have patients in your program.
Once you understand the patient's needs and mindset, you can begin thinking through the service and program elements that actually address the gaps of your patients and your customers. Historically, we've seen following as some of the key focus areas, and many of you will recognize things like coverage, benefits, navigation, savings, affordability, some of those upfront kind of transactional pieces that are cost of entry. And some of you may recognize a couple new ones here, like telemedicine, e-pharmacy, remote patient monitoring, may or may not be things included within your programs. One thing we're seeing is that the program design is often launched with an MVP, a minimally viable product. What is the most important context and most important content that the patient is going to need to successfully launch the product? And what you generally see over time is there's expansion. So you go with the minimally viable product at launch, you expand and start integrating more data, understanding your patient better, adding on service offerings. And then as your product goes later into its life cycle, you may start pulling some of them off. As your patients are understanding the dosing administration, you may not need all those pieces. You may look for digital efficiencies to identify patients at risk and proactively message them, kind of take some of the work off of the hands of the hub and digitize pieces of that. And then within specific disease states, you're going to see changes over time as well, based on the patient population or based on market events. And COVID clearly changed a lot within this. It clearly created digital transformation, which everyone talks about. But 2 really good examples of that would be one in the Crohn's and colitis space, where what a lot of companies were seeing is that their patients were having more flare-ups during COVID. The stress, the kind of mental and emotional burden on patients was becoming very challenging. So you'll see examples where companies actually partnered with a Headspace or a Sanbello or a Calm or someone like that to either integrate it within their program or just do right by the patient base and offer those mental, emotional, kind of broader, softer skill pieces within their support program. Or within immunology, those patients were hit really hard during COVID, and someone with an immunological condition didn't want to go into the physician's offices. So things like telemedicine and e-pharmacy became very important pieces to integrate with them. And other disease states have really just had to rethink their entire approach. One of them, I think, is a great example is obesity. And the following video, which we're going to play, is Christine Szymanski, the obesity consumer lead from Novo Nordisk, where she's going to walk through some considerations taken to the obesity patient experience design.
As you just heard, understanding your customers is key. Working in the obesity space for years has provided so many learnings, like people who live with excess weight or obesity, they actually make 7 serious attempts at weight loss in their lifetime. And that there are actually 2 phases of weight management. There's weight loss and weight maintenance. But the culture we live in only really focuses on weight loss. Or that there are many factors that contribute to a person's BMI, including genetics and hormones, among others. We now know that discipline and willpower alone can't cure obesity. And that words matter, like the word diet. A diet is something you start and stop. It's not a way of life. We also know that support is critical. So how do we get there? To build a successful solution, the most important thing that you can do is spend a lot of time up front, truly documenting the problems you need to solve. Now, these problems are typically the weaknesses, the barriers, the things that get in the way of a positive experience with your brand. These problems exist in many points along the buying process, and they often include a lot of different stakeholders. Problems may be uncovered when talking to clinical trial investigators or patients from clinical trials, unique market dynamics that are going on, side effect profiles, even insurance coverage and willingness to pay research. When you can truly understand the pain points across all stakeholders, that's the right time to gather your cross-functional leaders and discuss, debate, and prioritize that list. Because once you have a vetted list of problems to solve, you are truly ready to design an ecosystem that will drive your business.
When we planned for the We Go Together launch, a patient support program for those prescribed Wegovy for chronic weight management, as you might imagine, we spent a lot of time of our own understanding and documenting our list of problems to solve. What we quickly realized is that our list was robust, so we categorized all the problems as either start or stay problems. If we solved each problem individually in the more traditional way, we realized that we would actually place a lot of complex burden on the patient. So we knew we needed a new way of thinking and an inventive approach. So we went back to the drawing board. We brought in our design thinking team to facilitate experiential design sprints on each step, focusing on the simplicity for the patient. We invited cross-functional teams to help design solutions and accelerate the thinking in real time to make sure we considered all angles and make sure all experiences were actually feasible. As we digested all the thinking and moved to the next phase, a blueprint ecosystem was born. And this is what we used to build out our solution, in phases, of course. Tackling the problems to solve from a customer experience perspective was key. But one thing we all know is that there's no such thing as launching the perfect program, but rather getting that MVP, that minimally viable product, into market. So we considered the needs, desired experiences, and what each channel could deliver, like how transactional information could come in the form of text, while educational content would be best delivered in video or live conversations. We pinpointed where people would be most frustrated or confused and looked for ways to simplify that very experience. For example, we know people have distinct preferences for when and how they want to get information, and we also know that sometimes the question someone asks doesn't get them to the information they're looking for. So we explored ways to help navigate questions to more quickly get people to the accurate information they need, especially in the field of obesity. The right human engagement and channel options can make all the difference. Now, thinking about measurement is always an exciting and essential part. Setting up a robust backend is critical for tracking and reporting, of course. Now, there's the operational reporting, is the water flowing through all the program pipes the way that we had designed it. But more importantly, how can we look beyond how the program is performing and see how the program is delivering for individuals? By taking a look at the impact and trends we are seeing among different customer and patient cohorts. Looking at things like engagement by services, self-selected personalization profiles, and of course, overall business impact. To do this requires a lot of upfront time with privacy and legal, because the more we try to connect the dots, the more we rely on these team members to really collaborate. Fortunately, in innovative companies, with open and transparent dialogue come clear, prioritized, and patient-centric solutions. And once these are launched, relentlessly revisit that solution to be sure that it continues to deliver on the optimal experience. Always be listening and always be iterating.
As we think back to one of the bigger undertones of these patient support programs, data becomes a really important piece to plan for. And a far too common mistake is where teams wait until the last minute to think about how the data is going to connect. Christine mentioned the water flowing through the pipes, and that's too often something that happens only a few months pre-launch. And it's really important if you want to be able to customize the experience to the patient and help them in the exact moment they're in, that you're able to understand the patient. You're able to see across your hub, specialty pharmacy, your various financial support, educational support pieces, and tie it all together. And I think it's really important to say that there's not a one-stop shop, that you can create the perfect way to create a hub or set up internal versus external or integrate with others. It's really fit to the marketplace. It's fit to what do your patients need. And then within the ability to leverage data and connect patients, it's remote patient monitoring. And that's something that became very common during COVID. It's also something that the digital undertones around digital health and connected devices and all the various passive data collection that's happening throughout the industry now is just going to continue to get more important. And 2 years ago, CPT codes were expanded to allow for more billing around remote patient monitoring. Those trends were just accelerated through COVID. So this is something we're clearly going to see more of. And there's going to be more data than ever coming in that companies are going to have to process and understand. And the last piece is just, how do you make sense of all this data? And I think the holy grail with some of this is, how are you able to prove that through your product and through the various support aspects you're able to deliver to your patients, that there are tangible health economic benefits? And how can you use that to have conversations with payers, with health systems, with others in a compliant way, while maintaining patient privacy, but showing the potential impact that these types of programs can make? So we've talked a lot about the different types of a program and mentioned a little bit up front around how we get there, but a really nice process to put in place is first a deep understanding of your patient, of your physician, of your customer base through market research. It's mapping out the broader experience, not just what you want to happen on your product, but where patients have come from, where they've been, and the preconceived pain points and notions they may have coming into your product. And then continuing to validate that with stakeholder interviews and continuing to keep your patients and physicians close as you're building out these programs. As you're aligning on the solutions, it's looking at what you can do internal, where your traditional agencies are able to develop pieces versus where it may make sense to partner, either with some type of behavior change or tech company, or potentially with a patient advocacy or physician type group where you're able to leverage existing content that's already been built. And having a really strong plan connected around the program, all the pieces of components you have to do is going to be important. And that's going to be something that takes a lot of effort to have all these solutions integrated, have data thoughtfully built from the beginning, and have definitions of success created early. So 6 months, 12 months, 18 months post-launch, you can say, was my program successful and is it delivering on the needs of our patients? So that was a brief overview of some of our thoughts around patient services in the case study. We'd love to talk and share more of our thoughts around patient support, patient services, or any of the other service offerings that we have. You can see mine and Swathi's information here. And should you want more information or a hard copy of this, feel free to scan the QR code here or go to our website to learn more.